Hi guys, my name is Chris Chukwunyere and I'm a public health practitioner, and I believe that you've been practicing social distancing and every other thing that um, has been put out there for you to prevent yourself from being infected by the coronavirus. So today I'm going to be talking about social distancing and why it's important to actually practice it and why it's important to implement social distancing. Its effectiveness in the prevention and control of the spread of the coronavirus. So, what is social distancing? It practically means physical distancing, just staying some meters away from people, avoiding contact with them. And that's really very important because it's something that can actually help to prevent the virus from spreading at a very large scale. Social distancing will be effective in situations where people cough and sneeze to spread the droplet that contains the virus. So if you're in an environment where someone coughs and sneezes, the virus containing the droplet that was expressed can be inhaled by you and you can get infected. Another case is a case of direct contact, which also has to do with sexual intercourse as well, or kissing someone. This is an exchange of fluid, and that can get you infected. And then the third thing is in cases of indirect contact, where surfaces have been contaminated by the virus. So when you shake someone's hands, when you touch the ATM, when you sit in the bus and touch or hold the rails in the bus and the train, if those surfaces are contaminated, you probably could get infected if you transmit the virus into your system. So these are the different ways at which people can get infected. But the most important thing is this: in all of these situations, we are the people who get these things into our system. That's why we need to protect ourselves. Social distancing is very important because you may be close to someone and they cough and sneeze and you are not protected or you're not wearing a face mask. N95 face mask, not just any face mask, because the other face mask has some openings by the side, and so you can still inhale the droplet. So if you are not well protected, that can actually go into your system. And it's also important to note that if you are within 2 meters to the person that is infected by the virus for 15 minutes, there is a tendency that you would have it, because if the person is sneezing and coughing and you're within 2 meters to that person for 15 minutes, there's a tendency that you have it. So that is why social distancing is important, because there is need to flatten the epidemiological curve that is spiking up. What do I mean by that? It means that there is need to reduce the rate of spread across the population. So if the curve is very high because a lot of people are being infected, what social distancing does with population is to ensure that they reduce the spread by staying away, staying at home, not going to the office. That way you reduce the rate of spread. You flatten the curve. So let's imagine this scenario. Someone wakes up in the morning, a man wakes up in the morning and is heading to work. He gets into the bus. For instance, this is how I go to work. I get into the bus in the morning. That's the first place, I come out of the house, I get into the bus. And then the bus takes me to the metro station. I get into the train, the subway. And then when I alight at my bus stop or my stop, I take a walk and then I get into the office building. I press the elevator knob and then I get into the elevator. I click the level I'm going to go to. And then when I get to the front door of the office. I touch the handle of the door. I open it. And then I get in, I go and sit on my table. But most of the times, what I do is because of the coronavirus, I now go to wash my hands. But then when I wash my hands in the kitchen, in the office, there is the coffee maker. I have to press something, a button there. There is the water dispenser. I still have to press a button there. There is the hand wash basin. I still have to open the tap. And then when I want to go ease myself, I go to the bathroom, I open the door of the bathroom, I use the toilet, I wash my hands, I open the tap. So as you can see, there are several points in this case where I would have to touch a surface. And if someone has contaminated any of these surfaces, the doorknob, the elevator button, the rail in the train, the rail in the bus, the coffee maker, everything, and I touch that surface, and then I use my hands to touch my face or use it to pick something to eat, then I can actually get infected. Now, imagine I have a son. Now, this is one of the scenarios. And then I get to shake people along the way. I meet with my friends, after work. And then, hey, I've not washed my hands. I shake hands with them. We go into the bar and we order for chicken or something. And then I didn't wash my hands and I pick it, I put it, or I touch my face, or they touch their faces because they have also been contaminated because I was contaminated. And then they use the bar and someone else comes to use the bar. Maybe they sneeze on top of the table and someone else comes and touches the table. That's how you actually spread the thing. So social distancing helps to reduce that level of spread. Now, for instance, I'm married and my wife is here, my son is here, and I decide to come back home. And while I'm coming back home, my son sees me and runs towards me to hug me, and I carry him. There's a tendency that that boy may also be contaminated because I hadn't washed my hands when I got to the house. So there's a tendency that you may infect 1 to 4 people during the day. That is if you are infected by the coronavirus itself. Now, this is how this also happens. A lot of people are asymptomatic, which means that they don't express symptoms of the disease. Especially for young people, it could even be a mild case. And because it has some of the characteristics of a flu, you may just have, that dry cough and maybe a little fever, and you don't have that shortness of breath. So it may just be very mild and you may not even take it to be anything. You just take your normal medication and you're fine. Now, the thing is, if 2 out of the 4 people you probably get in contact with or who come in contact with you or who touch the surface that you've touched are older people or people who are immunosuppressed, there is the tendency that their case may be a lot more severe and possibly they could die. So this is why social distancing is important. You may not feel sick, you may not look sick, but if you're already carrying the virus, you may spread it to children, you may spread it to older people who do not have that strong immunity to fight the disease. So that is why it's important to shut down the workplace, because you're going to you probably would be with infected people and have contact with them for more than 15 minutes. That's why you need to shut down the churches. That's why you need to shut down some crowded mobility measures, shut down parties, shut down clubs, shut down gatherings, that serve as an atmosphere for spread. This is why it's important that we all adhere to social distancing, isolating ourselves. Very important. Quarantining. That countries are shutting down their borders because they want to ensure that mobility is reduced and the spread can be reduced. So think about other people, think about children. You may not look sick, you may not feel sick, but there are people who could probably die out of this. So obey social distancing. Take these measures. And as you do these things, make sure you keep washing your hands, use a hand sanitizer, do not touch your face. The body of the virus needs a vehicle to get into your system. So it's in our hands to protect ourselves. Don't touch your face, wash your hands before you eat. Wash your hands, don't put your hands in your nose, in your ears, rub your eyes. These are avenues through which the virus can get into your system. I believe that this will help you maintain social distancing. All right, guys, take care and bye.